It was meant to be the health reform plan to end the blame game, but the Prime Minister Julia Gillard has abandoned her predecessor's bid to take control of the nation's hospitals. Instead, state and territory leaders will be presented with a watered-down version on Sunday. The ABC's been told Kevin Rudd argued against the changes during a cabinet meeting last night. Chief Political Correspondent Mark Simpkin.
It's a whole new prescription. Julia Gillard's plan is both a compromise and a back down.
It is now clear that the agreement that Prime Minister Rudd negotiated will not become a national agreement.
To get a national agreement, the Prime Minister will bow to Western Australia and Victoria. The Commonwealth will no longer claw back any of the state's GST payments. The promise to become the majority funder of healthcare is also gone. Instead, the federal government will pay 50% of future cost increases.
Patients don't end up worrying themselves about whose name is on that pile of money. Does the little plaque say state or does the little plaque say federal?
$16 billion will be injected, and the government's promising additional money for after-hours GP services. In return, the states have to agree to put their money into a national pool and adhere to national standards, including a 4-hour target for casualty waiting times.
This is a historic capitulation on what the government was proposing. This is the biggest surrender since Singapore.
But will it be a breakthrough?
There is a very real possibility of national reform on health.
I think Julia Gillard has paved the way for a resolution of this by simply taking the issue of the GST out.
I won't be signing up to anything on Sunday, and we won't be agreeing to anything until we've had a really good look at it.
The ABC's been told Kevin Rudd isn't happy about his reforms being dismembered. At last night's cabinet meeting, he argued strongly for majority Commonwealth funding. Sources say that after he made his point, he stood up, said, "I've got to go," and left the room.
The nation needs fundamental health reform, fundamental hospitals reform. A lot of work has gone into this in the past.
Internal tension can be bipartisan. Privately, some Liberals are complaining about Julie Bishop's performance as Deputy Leader.
Do you have your leader's support?
Absolutely.
All of my senior colleagues have my full and total support.
A show of unity Liberals wish wasn't necessary. Mark Simpkin, ABC News, Canberra.